In normal conventional sampling, also there is need of centrifugation, centrifugation of blood to uh, extract plasma from the blood, from the venous blood. There is a point that uh, TDM, therapeutic drug monitoring of rifampicin and isoniazid, has required the plasma sample to be stored immediately at minus 70 degrees centigrade and transported with dry ice to the laboratory within 4 days of collection. Like if we are taking conventional sampling, we are doing conventional sampling, then we take venous blood and for the therapeutic drug monitoring of isoniazid and rifampicin, that venous blood is stored immediately at minus 70 degrees centigrade, and then within 4 days the sample must reach to the laboratory for further evaluation. Then there is need of centrifugation to extract plasma from blood. Then therapeutic drug monitoring is uh, process of therapeutic drug monitoring is done like so. There is no need of centrifugation or any other type of facility for the dried blood spot sampling technique. There are issues of contamination in dried blood spot, like if the layman will do dried blood spot sample technique, there will be issues of contamination. So there they should be must be taught or trained very clearly for the using of alcohol swab, isopropyl alcohol swab, to first clean the subject area or fingertip. Also, why the TDM by dried blood spot sample technique is necessary? Especially dried blood spot sampling is necessary for the HIV prevalence areas. Sometimes there is a co-infection of HIV and tuberculosis in backward areas, in the areas where there is high prevalence of HIV and co-infection of HIV with tuberculosis. There is dried blood sample technique is very much important. Why? Because there is drug interaction between HIV treatment and tuberculosis drugs. Like rifampicin is inducer of cytochrome P450, and all the drugs of HIV, antiretroviral drugs, these are all metabolized by cytochrome P450. So there is drug interaction between rifampicin and HIV drugs. So there is need of checking the to for the dose adjustment and optimization of treatment. So there is the protease inhibitor and non-nucleoside reverse transcriptase inhibitors used in HIV treatment are all affected by the cytochrome P450. Also, rifabutin is used instead of rifampicin in the case of co-infection of HIV and tuberculosis to avoid any type of drug interactions. So also rifabutin is still inhibited. Metabolism of rifabutin is also inhibited by the HIV drugs. So also there is need to adjust the dose by dried blood spot sampling. Like also in other dried blood spot sampling methods need to be validated in terms of selectivity, reproducibility, specificity, recovery, and stability. Also Other methods I will discuss in next video.